Hi there, my name is Kyle. I am a nurse practitioner student over at MCP, and today I will be doing an abdominal assessment. Can you just tell me your name and your date of birth, please?
My name is Nate Lewis, 6/15/93.
Okay. So first off, we're going to be starting off inspecting your abdomen. So I'm just going to lift up your shirt here. So what we're checking for is the skin, the vasculature, any pulsations, scarring, which none are noted. Next, I will be auscultating bowel sounds in a clockwise manner, starting with the left lower quadrant. I'm sorry, right lower quadrant. Okay, so bowel sounds are present in all four quadrants. Next, I will be auscultating for bruits. So I will be checking the aortic, the renal arteries, iliac arteries, and then femoral. And I'll be using the bell of my stethoscope. Okay. So next off, I will be auscultating the liver to check for any friction rubs. Okay, so no friction rubs noted. Next, I will be percussing his abdomen in all quadrants, and I should be noting some tympany and some dullness. Okay, so next I will be percussing the liver, and I will be doing that at the MCL line, and that's how I would measure where the liver is. So right over here. So as you can notice, you should be hearing some tympany here, and then some dullness. Okay, and then next I will be percussing the spleen, which is on the left side here. So next, I will be doing some light palpation, and I want you to tell me if you feel any pain. Okay.
No pain.
All right. Next will be deep palpation, and then I will palpate the liver by using the hook technique. So I'm actually going to go in and go under here, and I should be able to palpate. Okay, and then next I will be palpating the kidneys, which are on the flank here. Okay. Next I will be checking the inguinal nodes to check for anything which would be located here. I would palpate those. Also, I would palpate the aortic for any pulsations here. Okay. So no palpations noted. Next, I will be doing a series of tests. First would be the rebound tenderness, which the patient should feel if the minute I let go of pressure, the patient should feel, if they do feel pain, that would be a positive test there. And then the Iliopsis sign, Rosenvig sign, Obturator sign, which all test for the appendix, for appendicitis. And then lastly, the Murphy sign, which is for the gallbladder, for cholecystitis. So first, I'm going to check for rebound tenderness. So push off. Do you feel any pain there?
No pain.
Okay. Okay, so next will be the ileopsis sign. So what I'm going to have the patient do, I'm going to have him roll over on the left side here, and now I'm going to put pressure here, bend the knee, and he feels pain over here in the hip area. That would be a positive sign. Okay. Next will be the obturator sign. So what I'm going to do here is I'm going to go for the right leg. I'm going to bend it here at the hip, and if he feels any pain on the left side, that will be a positive sign. No pain there. Next would be the Rosenberg sign. So what I'm going to do here is I'm going to palpate the right side of his abdomen. If he feels any pain on the left side, that would indicate a positive sign. So do you feel any pain?
No pain.
Okay. And then next would be the Murphy sign. So what I'm going to do there is I'm going to put pressure here. I'm going to have you take a deep, deep breath. Okay. And no pain there. And then finally, what we would do a rectal exam. So how we would set up for that is I would actually have the patient lie on his side here, and then we would get a sample there. And then that is the end of the exam. Do you have any questions?
No questions.
Okay.